So today our group is going to be talking about quality improvement. So the topics that are going to be covered today are reducing nurse fatigue, reducing medication errors, reducing the risk of infection, and lastly, reducing staff turnover. So today I'm going to be talking about what nurse fatigue is, what causes it, how to reduce it, and ultimately its role in quality of patient care. Nurse fatigue, otherwise known as nurse burnout, is the state of mental, physical, and emotional exhaustion for those in the nursing profession. Nurse fatigue can be the cause of a lot of different kinds of mistakes, leading to poor quality of patient care and bad patient outcomes. Specifically, nursing fatigue can cause the following: slowed reaction time, medication errors, which can include switching patients' medications or giving the wrong dose of a medication, poor quality of patient care, and poor teamwork, which can look like not reporting to the proper people on time or not documenting in a timely fashion. It can also be compromising problem solving and lapses in attention to detail and judgment, which is clearly an important aspect in all of patient care. But overall, nursing fatigue is a danger to patient safety as it can result in accidents, mistakes, and errors, some of which can lead to legal consequences, including the loss of a license. Plenty of things can cause nurse fatigue, which can include working long shifts, night shifts, rotating shifts, and mandatory or voluntary overtime. Any of these can cause tiredness, lack of sleep, and it can compromise the circadian rhythm. Other things that can contribute are staff shortages, which would cause the remaining nurses to have to pick up extra shifts and hours. And there's also outside factors, such as poor quantity or quality of sleep, stress, social and or family life, lifestyle choices, nutrition, medication, illnesses, etc. Nurses have the responsibility to themselves and their patients and also their team to be well rested in order to provide the best quality of care. So both nurses and their employers can do things to avoid nurse fatigue and its negative outcomes. Nurses can do the following to reduce nurse fatigue. They can prioritize their sleep and their own health, stay physically active outside of work, make good lifestyle, social, and nutritional choices. So they would want to stay hydrated, avoid too much caffeine, avoid excessive alcohol intake, avoid drugs, and eat healthy foods to provide enough energy to meet your body's demands. They should also avoid medications that can cause drowsiness. They should take breaks and know their limits. So when it comes to scheduling week by week, or even if they can pick up overtime, they should know when they need a break or when they can pick up some extra time. So some of the things that employers can do to reduce nurse fatigue could be things like designing a work schedule that reduces the risk of nursing fatigue. So that might look like limiting the number of consecutive days nurses can work and provide opportunities to work shorter shifts, like an 8-hour shift rather than a 12-hour shift. Employers can limit last-minute schedule changes. This would help nurses to have the time to prepare for a shift by getting an adequate amount of sleep beforehand. They should maintain adequate staffing in order to maintain a safe nurse-to-patient ratio. They should not require overtime, and they should be more sensitive to recent nursing school graduates. Typically, recent nursing school graduates are very stressed with the transition between student to nurse, and they're also learning or relearning things on the job. There's no need for employers to add to that kind of stress and potentially causing nurse fatigue or even turnover. Employers should also provide staff education on the risks of nursing fatigue and how to reduce it. And lastly, they should be considerate when scheduling staff meetings. They shouldn't require anyone to get up early or to stay late. But overall, employers should take the risk of nursing fatigue into consideration. The University of St. Augustine for Health Sciences states that prolonged stress for nurses can be caused by some of the following: having more than 4 patients, working in shifts of 12 to 13 hours instead of 8 to 9 hours, and stressful specialties like working in the ED or ICU. High stress environments can contribute to nurse fatigue, and those days or specialties can include things like combative patients, traumatic injuries, ethical dilemmas, and high mortality rates. Employers and healthcare team members should be supportive and collaborative in their practice to avoid any additional stress and errors. So some of the statistics I found in my research that related to nurse burnout are as follows. Nurses with greater than a 1 to 4 nurse to patient ratio have a higher risk of burnout, with each additional patient raising the risk by 23%. In a survey conducted by Kronos Incorporated, 25% of the nurses reported that they were unable to get enough sleep in between their shifts. In a separate survey, but still done by Kronos Incorporated, listed that 85% of the 257 RNs that were asked reported that their jobs made them feel fatigued overall, and 63% of the 257 RNs said that their work had resulted in nurse burnout, and 41% of the 257 RNs considered changing hospitals in the past year, which at the time was 2017. But bringing this into the last couple of years, COVID-19 has a detrimental impact to the nursing burnout. More than 6,500 critical care nurses took a survey conducted by American Association of Critical Care Nurses back in September of 2021. 92% reported that the pandemic had depleted nurses at their hospitals, and as a result, their own nursing careers would be shorter than they intended it to be. 66% of the nurses in that survey said that they were considering leaving the profession because of their COVID-19 experience. Prior to the pandemic, nurses who experienced burnout were leaving the workforce at exponential rates. COVID-19 has put added pressure on the already existing nursing shortage. A lack of enough nurses in the workforce has forced nurses to work more shifts and longer hours, further placing them at risk for experiencing nurse burnout. Touching on a current topic that is terrifying the nursing community, the RaDonda Vaught trial can be a present-day real-life example of the horrors that nurse fatigue can cause. While there is more than just the one issue in her trial, I wanted to point out a quote that was from a news article covering her case. Ms. Kennedy, who was the editor-in-chief for American Journal of Nursing, states, quote, "We know that the more patients a nurse has, the more room there is for error. We know that when nurses work longer shifts, there is more room for error. So I think nurses get very concerned because they know this could be them." On that note, I encourage everyone to read up on the trial so that when we enter the nursing field in just a few short months, we can avoid those fatal mistakes. But overall, avoiding the nurse fatigue is mostly a balance between the nurse and their employer. Nurses need to know their limits and their role in preventing nurse fatigue, and employers need to know the risk of nursing fatigue is very real and take that into consideration. If this balance is maintained, this would drastically reduce nurse burnout and improve the quality of patient care.
So I will be covering reducing medication errors. A medication error, as defined by Mayo Clinic, is it refers to the mistakes in prescribing, dispensing, and giving medications. The FDA defines medication errors as a preventable event that may cause or lead to inappropriate medication or medication use or patient harm. Medication errors are a lot more common than people think. The FDA receives more than 100,000 reports every year that are associated with medication errors. 41% of Americans have been involved with a medication error. More than 7 million patients in the United States are affected by medication errors each year, and 10% of hospital patients will be subjected to medication errors. Some facts. Every year, 7,000 to 9,000 Americans die as a result of medication errors. They cause at least one death every day in the United States. Medication errors are the 8th leading cause of death in the United States, and they injure more than 1.3 million people each year in the United States. So some of the common medication errors include wrong medication or IV fluids, incorrect dose or rate, the wrong patient, wrong route, wrong time, administering allergy-inducing medications, omission of a dose or administration of extra doses, incorrect discontinuation of a medication or IV fluids, inaccurate prescribing, and inadvertently giving a medication that has a similar name. So I will be going over the rights of safe medication administration. This is also known as the 5+5 rights of medication administration. These include the right patient. The Joint Commission requires 2 forms of identification before administering medications. This can be asking the patient for their name and date of birth. If the patient is unable to provide that information, if they were a child or an adult with a developmental disorder, then you can ask a family member. If the patient has the same last name as someone on the floor or the same first name, then a name alert tag should be on, they should have a name alert bracelet, or it should be on the board where the patient board is, somewhere, letting the nurses and staff know. Then the right medication, you want to correctly interpret medication prescriptions. The nurses need to read the medication labels and compare them with the MAR 3 times. This includes when you remove the medication from the Pyxis, when you are preparing the medication, and right before you administer it to the patient when you are in their presence. You also want to become familiar with the components of a drug order. This way, if you see that something is missing, you can contact the provider for clarification. So the right dose, the nurse has to verify that the dose administered is the amount that was ordered and it is safe for the patient. Many medications are weight-based, especially in pediatrics, medical, surgical, and critical care. It is also important for the nurses to check the correct dosage range from a reputable drug source or by consulting the pharmacist. Some medications do require the dose to be checked by 2 nurses. Right time, this refers to the time the medication is to be administered. The use of military time can reduce administration errors and decreases documentation. Right route, this refers to the mechanism by which the medication enters the body. Routes include oral, sublingual, feeding tube, topical, suppository, inhalation, or intravenously. The list goes on. A nursing intervention for that is you want to make sure that the patient is in NPO before administering oral medications, and make sure that they have a speech and swallow consult if applicable. According to the Joint Commission, drugs must be identifiable up until the point of administration So it is not recommended to mix the drugs together. The best practice is to administer one medication at a time. Right documentation, the nurse should immediately record the appropriate information regarding the administration. Information that is documented by the nurse is the name of the drug, the dose, the route, the time, and the date, and then the nurse's initials or signature. The nurse should also document the patient's response to the medication. This is often done if the patient is receiving a pain medication such as an opioid or a non-opioid, sedatives and antiemetics. Right to patient education. The patient has a right to receive accurate information regarding each medication they are receiving, and why they are taking it. The nurse should also educate the patient on any possible side effects and signs and symptoms of an adverse reaction, and also any dietary monitoring or restrictions. The nurse should also try to have the patient perform a return demonstration to show that they can administer their own medications. The right to refuse. The patient has the right to refuse any medications. It's the nurse's job to figure out why they are refusing the medication and educate the patient on the risks behind refusing the medication, and also reinforce the importance of taking it. Right to assessment. This requires the nurse to have a baseline assessment prior to medication administration. This includes vital signs, checking the lab values. The nurse should also identify high-risk patients like those with medication allergies, patients on dialysis, diabetic patients, elderly, pediatric patients, etc. Identifying the patient's risk factors enables the nurse to take certain precautions to reduce risks. And then the right to evaluation. This determines the effectiveness of medication based on the patient's responses. The nurse needs to evaluate the therapeutic effect of the medication they are being given by assessing the patient for side effects and adverse reactions. So a big point in reducing medication errors is distractions. Interruptions are responsible for 45% of medication errors. So it is crucial for reducing errors. Data shows that interruptions are the cause of 45% of medication errors, and to help reduce this risk, many facilities are making medication safety zones by implementing policies that provide for a medication room or safety area. The zone provides for a quiet space where the nurse can pull the medications, do their checks with minimal distractions. This room would also have the EMR available so they can make sure they're pulling the medication for the right patients, the right dose and everything. They don't have to go out into the hallway or into the patient's room to do those checks. These rooms also have adequate lighting, which aids in the safe medication preparation. According to the United States Pharmacopoeia, there are 5 key conditions that contribute to risk in medication safety. These include workspace organization, lighting, interruptions and distractions, sounds and noises, and medication safety zones. So the Center for Health Design proposed design considerations for when creating these areas. This includes the placement of the room, not in a busy area of the unit or hospital, to limit noise. They recommended structural changes for the facility's HVAC systems, and also providing a clear visualization of the medications by minimizing clutter. They also recommended not putting look-alike, sound-alike drugs near each other to also minimize the risk of pulling the wrong med. This is the Joint Commission's official do not use list. The purpose of this list is to avoid error-prone abbreviations. I will not go through all of them, but pretty much you just, instead of abbreviating any of these words, you just write it out, because many medication errors come from abbreviations, especially if the prescriptions are written by hand versus entered into a computer. So before Alex starts, I just want to briefly go over how to avoid medication errors. So as we spoke about before, you want minimal distractions, as this is the main cause of errors. You want to ensure that you verify the 5+5 rights of medication, and using a barcode scanner can also aid in making sure that you're giving the medication to the right patient. Talking to the pharmacy and other members of your team can help with clarification on any medications you're unsure of, any doses you're unsure of, especially with look-alike, sound-alike medications. Have a cosigner for high alert medications. Having a solid understanding of how the medication is to be administered, any adverse reactions, common side effects. A good way for this, especially as a new grad nurse, you can have a drug guide on you, similar to the one we get in school, just to be able to quickly look up medications before you give them. If you are unsure about a medication, or if you notice that the provider provided something in error, or a dose was too high, always question it, because at the end of the day, we are liable, even though we weren't the ones who ordered it. We are still administering medications. To briefly talk about what Jess brought up earlier with Redonda Vaught, she performed many medication errors, obviously, which led to the death of a patient. But she did not perform any of the medication checks that she was supposed to. She didn't do the 5+5. She did not make sure it was the right medication, the right dose. She didn't even look at the vial that she was giving. And she was also unfamiliar with the medication that she was giving. Versed, which was the prescribed medication, also midazolam, is actually it's a liquid form of a medication, where the medication that she ended up giving, vecuronium, actually needs to be reconstituted. So had she known the difference, I mean, she should have done the checks prior, but had she known the difference in how those medications should have been prepared before administration, that could have stopped her from administering it to this patient. So really, in making sure that you follow all of these steps can alleviate any errors that could possibly happen.
I'm going to be talking about reducing the risk for nosocomial infections. Nosocomial infection is also called a healthcare-associated infection. To be considered nosocomial, the infection cannot be present upon admission. If these infections are not treated, they can lead to more serious health issues like sepsis or even death. Nosocomial infections can cause illness to the patient, a longer hospital stay, which can lead to bigger costs associated with the longer hospital stay, and a longer recovery time for the patient. Everyone admitted into the hospital are at some type of risk to developing an infection that they didn't already present with. So there are several types of nosocomial infections. Common ways they can be transmitted are bacterial. Bacteria are the most common cause of nosocomial infections. Common bacteria are E. coli and staph. There's also fungal. The most common fungi that causes nosocomial infections are Candida and Aspergillus, which is caused by actually breathing in mold. And there's viral that can be caused by viruses. Many things within the hospital environment can cause nosocomial infections. A common thing is antibiotics. So when you're being treated for an existing infection, the doctor may prescribe an antibiotic that this can kill the both healthy and unhealthy bacteria in your body, and it can weaken your immune system, increasing the risk for an infection to develop. And misuse of antibiotics can also cause antibiotic resistant strands of bacteria, such as MRSA. So, this may be like not finishing your antibiotics or taking antibiotics for, let's say, a viral infection. So, a common infection that people develop within the hospital setting are a catheter associated urinary tract infection. This is also known as a CAUTI. UTIs are the most common type of healthcare associated infection. Within the UTIs acquired in the hospital, according to the CDC, 75% of them are actually associated with the use of a urinary catheter. And a urinary catheter are tubes that are inserted into your bladder to help you void. Leaving a catheter in too long can cause a bacterial urinary tract infection. Pathogens are spread through a contaminated catheter, through improper insertion or inadequate bathing. And some ways that you can reduce the risk for CAUTIs are to minimize urinary catheter use and duration, to avoid urinary catheters in patients for just management of incontinence. You want to try other ways to get them to void. Consider using external catheters as an alternative for indwelling catheters. You want to make sure that you are performing hand hygiene immediately before and after insertion. And if you're manipulating or trying to move the catheter, just make sure you wash your hands before and after as well. And you want to make sure that you are using aseptic technique and sterile equipment while handling this device. So you can implement quality improvement strategies to help reduce the risk for CAUTIs. Some of these strategies can identify clients that catheters are no longer needed. You want to make sure that you're encouraging the staff to use proper hand hygiene and the appropriate use. The hospitals may also implement alerts to identify clients with catheters and assess the continued need for it. Um, and to also enforce continued education on catheter care and importance of proper hand hygiene. So some treatments of nosocomial infections, they can be treated with antibiotics to kill the harmful bacteria, fluids to help fight the infection and to keep you hydrated. You want to also make sure to rest to let your immune system fight off the infection that's developed. And early identification is important to identifying the infection and just continued assessments of your patients as well. How can nosocomial infections be prevented? They can be prevented or reduced by washing your hands regularly and proper hand hygiene. This is the number one thing that can help reduce the infections. You want to avoid unnecessary use of urinary catheters, which we already discussed. You want to make sure that you're wearing protective equipment like gloves, masks, and that you're practicing proper aseptic technique. So could be routine disinfectant of surfaces, of patient surfaces, and medical equipment as well, including vital machines. Some more ways are following standard precautions. This can mean making sure that you have precaution signs posted on the doors of patients who need them. You want to make sure you're identifying risks for infection and identifying patients that are more immune compromised. You want to make sure you have early nutrition and assessment for your patients, and designating an infection control team can also help with reducing these. So I'm just going to talk about some statistics related to nosocomial infections. They are among the leading cause of preventable deaths in the United States, affecting 1 in 17 hospitalized patients, accounting for an estimated 1.7 million infections and an associated 98,000 deaths. Studies indicate that between 30 and 50% of antibiotics prescribed in hospitals and between 40 to 75% of antibiotics prescribed in nursing homes are unnecessary. Infections acquired in healthcare settings are the most frequent adverse event in the healthcare delivery worldwide.
Okay, so now I'm going to be talking about turnover rate. Turnover is the term that has many definitions because it's mostly used in nursing and can be defined as any nurse leaving an organization. This can include voluntary or involuntary leaving. The number can be represented as a percentage, which is going to be called turnover rate. According to 2021 NSI National Healthcare Retention and RN Staffing Report, the national turnover rate for RNs was 18.7% during the year of 2020. A high or increased turnover rate has become a serious issue in nursing because it is creating an increased nursing shortage for healthcare systems all over the world. Higher rates of nurse turnover are also associated with unsafe and undesirable outcomes for patients. Therefore, it is essential to identify key elements that influence nursing turnover, to develop retention strategies, and to promote nursing satisfaction, as well as safe and positive patient outcomes. There are some different types of staff turnover, one of which is voluntary turnover, like I mentioned in the previous slide. This is when an employee leaves a job. This includes no-shows, employees who have found another job, employees that left for personal reasons, employees that returned to education, employees that joined the army or the military, employees that moved away or simply left because they didn't like the job or other team members. Another type is involuntary turnover, which is when an employee is terminated from a job. This can be due to poor performance. The employees came up with an unsatisfactory background check. The employee made a violation of company policy, misconduct, or insubordination. Another type is retirement. This is when the employee has reached the end of their working life and takes a well-earned break. internal transfer is also considered a type of turnover, and this is when a valuable employee has been promoted or moved to another department within the organization. Functional turnover is defined as the poor performers that leave the organization. This is when they are not asked to leave, but they do so because they feel like they are not at the end of the road to. Dysfunctional turnover is when a top talent leaves the organization and they may have been pushed by a competitor for better pay and job role, or they may have requested working conditions or concessions and have them refused. This is going to show some of the top reasons why RNs leave their job. 16% is caused by staffing and workload. 12% is due to career opportunities. This can be when like an employee gets another job offer, or they just move like for continuing their education. 11% is for immediate superior. This is when there is disagreements with the above superior and the employee simply just decide to leave on their own, or they get fired. 10% is for compensation and benefits. This is to low pay rates or low benefits. Either the employees are not allowed to take their well-earned vacations when they need it, or simply they just don't get the rights that they deserve. Another 10% is for hours and schedule. As we know, we all like to have flexible schedules, but sometimes that is not the case. Another 10% is for directors and management. This continue on with a 6% with co-workers and teamwork, as well as 5% for work environment. 4% is also for policies and procedures. 3% is for training and orientation. 3% is for treatment and respect. 3% for communication. 2% for job satisfaction, and another 2% for company reputation. This is a graph that I acquired from the National Health System that shows a report on the hospital staff RN turnover rate. This is for the a comparison from 2016 to 2020. As we see, and as I mentioned before, in 2020, the turnover staff rate is 18.7% or 70%. That is for all staff nurse. 15.7% is for only full-time and part-time employees. And the list goes on for 2019, I'm sorry, with 15.90% for all staff RNs and a 14.7% for full-time and part-time only. If we notice in the graph, there was a huge increase with about like 3% from the year 2019 to 2020. And I'm sure that now in 2021, when we obtain the report, now in 2022, we are going to see a higher increase. This other graph, I found it really interesting because it shows the turnover rate by a specialty. So the yellow line is going to show the national turnover rate for 2020. And the other percentage are just comparing the rate for 2020 and 2019 for different departments or units. Like we see for burn center, it was a 14% for 2019. And then for 2020, it was a 9.8%, which in that case, it decreased. For surgical services, in 2019, it was 15.3%. And then in 2020, it was 13.2%. It goes on with women's health, pediatrics, med surg, critical care, telemetry, emergency department, behavioral health, and step down. If we notice and we look closely to the graph, we can see how the step down, behavioral health, emergency, telemetry, and critical care almost surpassed the line for the national turnover rate, which is set at 18.7%. The step down for 2020, it had a 24.4% of turnover. The behavioral health had a 22.7%, and emergency department had a 20%, as well as telemetry, which was 19.3%. Turnover can cause a lot of cost for nurses and also for their organizations or hospitals. This information, I found it very interesting because it says that the average cost for turnover for a staff RN is $40,038, with the range averaging from $28,000 to $51,000. This is going to result in the average hospital losing $5.1 million per year. Annually, RN turnover costs a hospital between $3.6 million to $6.5 million. Breaking this down even further, each percent change in RN turnover will cost or save the average hospital about $270,000 per year. So we need to implement some ways to reduce turnover rate. We can do this by us, the nurses, or the management. So this is going to be by improving communication between administration, management, and staff. We can also reduce turnover rates by ensuring adequate nurse to patient staff ratios, as well as choosing an effective preceptor for the new graduates. We can also improve the onboarding process for new employees, as well as deal with conflict in an efficient way. We also can focus on fairness for our nurses, as well as offer better pay and benefits. We can also provide flexible work schedules, as well as promote respect and autonomy. Employees can also recognize staff and include new graduates program that allow new incoming nurses to gain their confidence in the work environment, as we're always anxious because we feel like we are not ready yet. Some of the benefits for nurse retention includes reduction in advertisement and recruitment costs, fewer vacancies and reduction in vacancy cost, fewer new hires and reduction in hiring cost, fewer orientees and reduced orientation and training costs, maintain or increase productivity, fewer terminations and reduction in termination costs, decrease patient errors and increase quality of care, improved work environment and culture, increase satisfaction, increase trust and accountability, preserve organizational knowledge, and easier nurse recruitment. To conclude, I just want to say that Inappropriate nursing staff rates are very unsafe and can lead to clinical and economic disadvantage in patient care. This includes decreased patient satisfaction, increased medication errors, incidences of fall, pressure ulcers, healthcare-associated infections, patient mortality, hospital readmission, and duration of stay, patient care costs, and nursing burnout. Nursing leaders need to ensure adequate nurse-to-patient ratios when doing shift assignments by assigning duties and responsibilities evenly among nurses. They can also choose effective preceptors for new nurses during their first year, as well as improve onboarding process since it was greatly affected due to COVID-19. Administrators and nursing managers should adapt current work conditions by allowing their nursing staff to express their opinions on how they can improve scheduling, day-to-day duties, and responsibilities process. Thank you for watching.